And I would imagine funding is another challenge. And, I'm wondering too, and Jeff, I guess I'll ask you first, that American Rescue Plan money that took effect in March, we're talking $4 billion for mental health and substance disorder treatments. Is the money there? Do we have it?
Some of it has started to come down from the federal government to the state government. Some of it has started to come into the counties. I would say, we've pushed pretty aggressively to say we need these funds now. We're in the middle of a crisis. In some cases, they've responded. In other cases, there's a lot of bureaucracy around these dollars, and I wish they were deployed into the community a little bit faster. The thing about, and kind of the common denominator between some of the physical health conditions that Michael mentioned and the behavioral health conditions is that left untreated, they get progressively worse. And by the time people present for services, whether it be mental health issues or substance use disorders, they're in a really bad place. When we think about substance use disorders, we're seeing folks now that are using heroin upwards of 20 to 30 times per day. Not occasionally, not a couple times a week. We're seeing people who are consuming a dozen drinks before noon. And so these are not folks that are new into the game. They're folks that have postponed getting services for up to 2 years. And keep in mind, one of the hallmarks of addiction is denial to even have a problem. And so you match that denial with some decreased access, and you have folks that are presenting in a very, very sick way who require a much higher level of care, sometimes inpatient care. And their road to recovery is going to be a longer one than if we got them earlier in that process.
And I also